Welcome to BW Healthcare World. As a part of our series on quality and patient safety, I have with me today Dr. Anuradha Pichumani, who is the Executive Director of Sree Renga Hospital at Chengalpattu in Tamil Nadu. She is also the Director of Narbhavi Multispeciality Hospitals and Kancheepuram in Tamil Nadu. Apart from being the director of these hospitals, she's also the faculty in many universities and is also the principal assessor at NABH. Welcome, Dr. Anuradha, to BW Healthcare World.
Yeah, good morning, Mr. Harbinder, and good morning and good evening to all the listeners of this podcast worldwide.
Dr. Anuradha, since we are doing this focused on the patient safety, can you briefly explain what the international patient safety goals are and why they are important in the business of healthcare?
Yeah, thank you for that. And especially I would like to thank CAHO, our quality professional wing, and your organization, the Business World, for doing this podcast every month. It's been really good, and I appreciate you and your team for doing this with a passion. And coming to your question on international patient safety goals, they are specifically important because patient safety has become a global challenge now. And we need to work on multiple areas like human factors and system engineering to understand and improve on our patient safety inside our healthcare. So we also had the World Patient Safety Day last month on September 17th. So coming to international patient safety goals, they are a set of guidelines what we have now to promote patient safety and quality within our healthcare organizations. And we have 6 goals. And to name them, the first goal is on identifying the patients correctly. Second one is to improve effective communication. Third one is to improve the safety of our high alert medications. And fourth one is on safe surgery, what we do inside our hospitals. Fifth one is on healthcare associated infections, what we call as HAI. And sixth one is to prevent faults happening within the organization, preventing harm. And to elaborate shortly on these 6 goals. So the goal one, these goals were formulated because these were identified as the major things which happen, which are preventable errors, which are occurring inside every organization across the world. So the first one, as I told you, was identifying the patients correctly. And for any procedure, be it clinical or non-clinical, any administration work, you have to identify the person correctly. And only then you will not be compromising on patient safety. So it is more important when you are going to give some medications or you are going to shift a patient or you are going to take up a patient for surgery. So for this, we have to have the way we ask hospitals to do is to have minimum 2 identifiers for every person inside the hospital. One can be the patient name, the other can be the hospital identification number. So that is about the first goal. So this has to be standardized and it has to be, you have to train your employees to do all this. And moving on to the second one, it's about the effective communication. So by effective communication, we mean there are various types of communication which happen during shift handovers between nurses, between doctors. And these are areas which are error prone. So you need to again standardize these communications and you have to establish protocols so that you improve on the communication so that it becomes more effective and it improves the patient safety. So this is about the second goal. Third goal, we talk about the high alert medication. Last year on World Patient Safety Day, the theme was on medication safety. And regarding medications, we have huge number of errors. It can be from the pharmacy or it can be during administration or it can be related to some adverse event happening due to the medications. So anytime you are going to give medications, the person who is going to give it have to double check it. And if it's going to be a high alert medication, we have certain drugs which are called as high alert because they have a very narrow margin of safety. So if you even give a minimum increase or decrease in the drug dosage, it will create huge problems in the patients. So you have to identify that type of drugs. And every time you have to do a double checking before you give it to the patient. The storage of look-alike and sound-alike medications and all these have to be taken care of. So that is about the third goal. Coming to the fourth goal, it is on safe surgery. We have various systems where we are trying to improve the safety of the surgery. during pre-op, or when you shift a patient into the theater, because we repeatedly have some incidents happening even in the best of hospitals. So these are all preventable errors which are happening due to the human interface. So the more and more we have human interfaces, we do have these errors. So we have a WHO safe surgery checklist now, so to ensure safe surgery. And the fifth goal is on reducing the hospital-acquired infections. So we need to improve on our infection control practices like hand hygiene, having a monitoring protocols with our teams, and training them, and having a proper surveillance to reduce these infections. And the last goal, the goal 6, is on preventing harm due to the patient fall, which can happen within the organization. So for this, again, we have certain standardized protocols where we try to find out the patients who are at risk for fall as soon as they enter the hospital itself. So we know the risk and we try to mitigate that risk. These are certain ways by which these IPSG goals, we call them as IPSG, the International Patient Safety Goals. And these are ways where you can improve the patient safety inside your organization. Yeah.
This is actually very good that you've explained, not just listed, because some of the things that came into my mind were that this is not just the negligence of an institution, but many of these could be prevented if patients themselves are cautious about it, and this could be an outcome of a patient negligence as well. Dr. Anuradha, how do these goals improve the patient safety outcomes in the healthcare?
Okay, so as you were telling now, we are trying to engage the patients in their own patient safety. So that's the theme for this year. This year's World Patient Safety Day given by WHO is engaging patients for patient safety. And it is very important that we do in all our organizations now. And WHO has defined patient safety as absence of harm, which is preventable basically to a patient who is inside a healthcare organization, or at least try to minimize the risk towards those type of harm. And since we have a huge number of adverse events happening, like there are 4 in 10 patients who have some event happening inside the organization, that's why we are trying to improve the patient safety outcome. So the accessibility has improved across the world, whereas the safety of the patients has to start increasing. So when we are trying to use this international patient safety goals, we are trying to standardize our practices across the hospital, across departments now. So we use certain protocols so that the patient safety is taken care of. And the second way where we are trying to improve the safety is you are trying to identify the risk for each and every individual who walks into your organization. So you're going to identify the risk, and also you're trying to do certain things to mitigate that risk. It can be infection prevention or drug administration or during any surgical procedure. That is the way we are going to improve the patient safety outcome. And the third way where we can do it is you are going to enhance the communication. So you are going to train your nurses, train your doctors to improve the effective communication within the organization, so that you don't have any error because of transfer of knowledge, the transfer of what has been done to the patient. It can be giving a double dose of the drug, same drug again, since the transfer of the knowledge was not done properly, the communication was not enough. And similarly, we are going to empower the patients as we were talking now. So we are going to empower the patient, and in that way, patient safety is ensured. So these are certain ways where we are going to improve the quality. And also when we are going to implement this IPSG goals, you are going to monitor them. So you have a team, your quality team or your safety team is going to monitor what is happening, collect the data, analyze the data of any near miss happening inside the organization, and then you're going to prevent it from happening again. So in this way, your patient safety outcome is ensured. Yeah.
Okay, Anuradha, you brought out this word, we're going to monitor once we implement. But some of these goals are created keeping in mind the international, healthcare systems. What are some of the common challenges or barriers in implementing IPSG in India?
Yeah, as you know, India is a land of so much of diversity. We have small hospitals, large hospitals, public hospitals, and each hospital has its own challenges. So we need to understand those challenges and then move it through so that you are able to implement these 6 goals at least, because these are the minimum things which we need to take care of. And so the major challenge for many of these smaller hospitals is resource constraint. So coming to the resource constraint, it can be either financial resources or it can be staff shortages. And so this training and support staff are very important when you're going to try to implement patient safety. And again, the second important thing which we all see is a resistance to change. So anything, people are so resistant to change of anything inside their own departments. So you need to talk to them, tell them that it is important. You need to have a buy-in with your frontline staff. That is very important whenever you're going to implement a change. So this with the buy-in and with your training, and again, the leadership becomes very important whenever you're going to implement any safety process within a department. So all these things put together, you'll be able to overcome the challenges. Again, sometimes the barrier is due to the lack of awareness, lack of training to the staff, and you will have some staff turnover. So repeatedly, when you have a turnover in your specific department, that is prone for error. So anytime when you have high attritions or you have a staff turnover in your organization, you need to take care of that department very well. So you need to get your people there so that you don't have any error till the next group starts taking over. And again, you have so many complex things happening for any procedure. So sometimes we use technology to implement these IPSG goals. And these technologies sometimes might be difficult to work with for your staff, or it will not work in some departments. So you need to overcome those barriers, make it more simple, so that every person in the hospital takes care of patient safety. That is the way you try to improve the culture of safety. Because again, whenever we talk about organization, I keep on telling about this culture. The main thing what we need to implement is the culture. When you have the culture right, then the safety starts going on with it. So these are the various challenges, and we need to overcome that. Yeah.
I think you brought out this brilliant point that safety and quality need to be a culture in an institution where everybody is a part of that culture. So it doesn't have to make an effort. They know what is expected. But the success of any program, like you said, is awareness. And there's nothing better than sharing stories to make people aware of the impact that they can create by talking about this. So can you share any success stories or examples of how implementation of IPSC has made a positive impact on patient care?
Yeah, definitely, Mr. Harbinder. It's a very good practice of sharing our own stories with each other, so that we take up learnings and improve on our own departments. So as you know, I'm a gynecologist, OBGYN consultant, practicing in a semi-urban area in southernmost part of India, in Tamil Nadu. So the staff coming into our hospitals, all of them are from rural background. So we definitely need to train them, and they come from various backgrounds, various diverse cultural background again. And getting these people to understand about safety and then retaining them is a very important part of the organization as a leader. So the way we have done it is we implemented NABH as the first person in this district. And again, in Tamil Nadu, we were the first to start doing this in National Accreditation Board for Hospitals. The accreditation part was done way back in 2010. We started working on it in 2010. We completed it in 2012. So the 10 years of accreditation, and we are still in the learning process. We learn day by day. And we have been working with our own group of employees who are very good, and they are the ground level staff who are implementing this safety goals. So to tell you something about all these goals, certain things are happening because NABH has asked us to do it. So for any accreditation process, getting the identification correct, having an ID band, doing a MOSFOL code checklist. So we have it for identifying patients who are at a risk for fall. So whenever we check it, we score each and every patient, and based on the score, we identify patients who are at risk, and we give them a colored ID band, and we give them specific training. We train the staff, we train the patient attenders also, that this patient is at a higher risk for fall and how to take care of them. All these are mandated many times in many accredited organizations. And beyond this, we have tried implementing certain things in our own organization. And being a small healthcare organization, this is a 47-bedded hospital, and it is a multi-speciality hospital. And we have implemented a safe handover tool, which we have taken it from the WHO. It is the WHO Safe Childbirth Checklist. Our hospital, Sree Renga Hospital, which is called as SRH. So this Sree Renga Hospital has been an implementing partner with the Harvard University, which is the Ariadne Labs, which is part of the Harvard University. And we implemented this WHO Safe Childbirth Checklist in our organization. So what this checklist does is, when a pregnant woman gets admitted inside our organization, so she moves through various phases, right from the admission process to the antenatal ward, then to the labor room, and then to a postnatal ward, and then there comes the point of discharge. So during all these touch points, she is seen by multiple teams, multiple times. And when you handle a patient with multiple teams, it's again prone for error. So that's why we started, we decided that we'll take up this safe childbirth checklist, and we implemented it in 2019 to 20. And we have been able to do it, and there's been no near miss, even no incident at all. So that's the way we are able to do this checklist as a safe handover tool to improve the communication between our staff. And seeing the results in our own organization, from CAHO, we have done it as a quality improvement project for 9 other hospitals in Tamil Nadu. So all of them have been implementing this safe childbirth checklist, and this is one of the ways we are able to implement safe obstetric care within our organization. And similarly, we have done certain things for medication safety using technology, where we have tried, though it's a small organization, we have tried sending all the prescriptions online. So we have trained our staff, and we have got software, done the training. And so all the prescriptions are through online, so that there is no error due to the handwritten documentation. So these are ways where we can improve on our safety. Again, we are trying to implement the barcoding for laboratory as well as for the case sheets for identifying patients. So these are things which you can use. We can improve the patient safety using simple technology tools. And the third thing which we have tried new this year is on engaging the patients for patient safety, since this was a theme for this year. And as part of ISCO's Patient for Patient Safety Committee, Patient and Family Centered Advisory Committee, and again in CAHO, we have the PAC, the Patient Advisory Councils, which are being formed across India now. So we had this PFCAC committee in our organization last 1 year, and we have tried including engaging the patients in their own patient safety, be it in improving the process in dialysis, improving the process in pharmacy. So all these things have been part of our organization to improve patient safety. Thank you.
Dr. Anuradha, you mentioned, we were talking about culture prior to this question. One thing that comes to our mind is that the culture in any organization, for whatever we talk of, is top down. So the leader has a very important role to play. What role does leadership play in driving these IPSGs?
Yeah, definitely. This leadership role is the most important thing when you're going to talk about any change in any organization. So setting the stage for zero harm is an important agenda for every leader in an organization. So that's what I truly believe. And getting to zero harm is the driving motivation, which will make healthcare organizations more resilient also. So the top leadership has to talk about safety repeatedly, and you cannot accept any process breakage in any part of your organization. So you have to, as a top leader, the leader has to give specific clear goals. The setting and defining your goal for the organization, you're going to steer the path of the whole departments on setting standards for patient safety. So as we were talking previously on the culture of safety, so this culture will set in only when the top leader starts practicing it. So the leader of the organization, he can be an administrative leader or he can be a clinical leader. Any type of leader has to start talking about safety, breathing about safety. So this is the way the culture starts growing within the organization. And you have to promote an open communication, because it is not enough you train your employees, you talk about culture. The second important part is it has to be an open communication. You have to allow your employees to come and talk to you regarding patient safety. Any person, it can be a nurse, it can be a doctor, it can be the most junior most doctor. So he has to tell us if there is some process breakage within the organization, if something was not followed, or if there was a near miss event which has happened. So that this open communication helps us to understand and start improving our own process. And again, as a leader, we have to allocate resources. Most of the leaders and organizations they start allocating resources for any equipment, for any specific infrastructure. Whereas you have to allocate resources only to improve your patient safety. It can be 10 patients or 100 patients. Each and every patient is important. So that's why you need to start improving the culture of safety, make your team accountable. When you're going to make it more accountable, the leader has to be more accountable first. When the leader becomes accountable, then your team also starts following. So you set the stage for making accountable teams, and every team leader, the person who is there in the department, the way we improved the culture of safety in my own small organization is, hospital is now 33 years old. So though it is a small hospital, we are surrounded by so many medical colleges here. There are more than 10 to 12 medical colleges around us. And though it is there, we have been running it for last 33 years with a culture of safety, quality, and ethics. The values are very important. So based on the leader's value, the whole organization starts going on. Be it the doctors, be it your consultants who are going to practice in your organization, or it can be your staff. So from top to bottom, every person becomes accountable. So you give importance to them and you start celebrating each and every success. So what we do is the last year, the Patient Safety Day, we gave out all the Safety Champion Awards. So we encourage each and every person who has identified a patient problem, issue, which has happened to a patient, and they were able to save the patient before it had flagged up. So these are ways where you improve on the patient safety. So you have to celebrate the success. You have to acknowledge people who are improving the patient safety, create your own champions, and try to retain those people within your organization. So I keep on seeing how many people have been with us for more than 20 years now, in spite of so many hospitals. So you start asking these questions. Instead of asking why people move out, start asking questions why people get retained in your organization. So they are getting retained in your organization because they like the culture. They like the value within an organization. So the whole safety depends only on the staff finally, the frontline workers. It can be a person who is going to shift your patient. It can be a person who is going to give some medication. So everything becomes important, and everything depends on the top leadership. That's what I keep on telling my doctors, my consultants. So I think this is a perfect question for a perfect patient safety. Thank you.
And Dr. Anuradha, my last question to you before I let you go is, looking ahead, what do you see is the future of IPSG and the impact it's going to create in the hospitals?
As we saw last, I think few weeks back, we were there in the CAHO Tech event in Delhi. You were also there, and we had a huge conference on patient healthcare, along with how the industry is going to support it, how we are going to integrate the technology with healthcare. So what I see in the future is you're going to have huge integration of technology to improve the patient safety, because as humans, we are all prone to errors. And in repetitive things, what we do on a daily basis, the repetition is again prone to produce some error. So for all these repetitive events, I think technology will work out in a better way. And we need to have some support system. It can be on the software, or it can be an automated alert, like a drug alert, drug allergy, which pops up, and you're not allowed to prescribe that drug at all for that specific patient. So these are certain things which will be improved with technology, and you will have some decision-making support where this technology helps us to improve on these patient safety goals. It can be for medication management, or it can be for patient monitoring, or when you're going to do a safe surgery checklist. All these things will take the help of technology in the future. And the second part of it will be on data. All of us have huge data in the hospital, and based on the data analysis, we have some evidence-based studies which will be coming up, in the future, which will help us to gain insights into how to improve the patient safety using these patient safety goals. And more importantly, it will be more personalized. The personalized patient safety, the person-centered care, which is going to be very important in the future. This each and every goal will be personalized. It can be for a surgery or it can be for a medication. Every individual, it will be a personalized care. And so the patient engagement will take a huge impact when we are going to improve on the patient safety goals. And all this can happen only with knowledge sharing, like how we do these podcasts. So these things are very important for knowledge sharing, and it will be a global collaboration with each and every country sharing best practices. And this will be the way forward in the future.
Dr. Anuradha, this has been such a meaningful conversation. The things that came out for me to understand regarding IPSG was that, what needs to happen is to work on two things. One is the managing the resistance to change at the institution level as well as at the individual level, where we talk about not just the business leaders, the staff, the doctors, everybody in the institution needs to be a part of the culture towards creating patient safety. The second thing is, which is not usually spoken of, is managing the expectation of the patients themselves. That they also have to have the responsibility to take care of themselves. So, as you said, that patient safety is, or IPSG is focused on reducing harms that are preventable. And this becomes a joint responsibility of the healthcare provider, which is the institution, the staff, the doctors, paramedical, as well as the patient themselves. There needs to be awareness that triggers the sense of responsibility at both ends. And that's with that, I'm going to, all I can say is gratitude for being with us today, speaking about patient safety, and also sharing examples of how it has actually created an impact, which could become an inspiration and motivator to everyone else to adopt and build and nurture the culture of safety in their institutions. So thank you so much for your time.
Thank you so much. It's been a great conversation today.